Did you know that way back in 2000, this Institute of Medicine report, to Err is Human, it flagged medical errors as the third leading cause of death in the U.S.?
Yeah, it's a shocking statistic. We're talking, what, over 250,000 deaths a year from errors?
Exactly. So today we're doing a deep dive into how we tackle that. Specifically, how clinical nurses, the ones right there at the bedside, constantly how they develop the patient's safety competency they need to prevent these kinds of errors.
Right. And it's important to understand what patient safety competency really means.
Mm-hmm.
It's not just about, like, technical skills.
Mm-hmm.
It's this whole package. The knowledge, the right attitudes, sharp ethical judgment
Methods of
about
preventing.
preventing problems, yeah, but also spotting them,
Mm.
reporting them, dealing with them effectively when they do happen.
And communication.
Teamwork.
Oh, absolutely crucial. They're kind of the glue holding it all together.
Okay, so let's get into the study we looked at. It focused on three main things influencing this competency in nurses. First up was formal safety education, the usual seminars, workshops.
Standard training stuff.
Right. Then there's the perception of patient safety culture. That's basically the vibe in the hospitals. You people really believe safety is top priority.
Like a shared belief system.
Exactly. And the third one was safety control. That's more individual. A nurse's own confidence and ability to make sure things are safe, make the right calls, maybe speak up if something seems off.
Yeah, like feeling empowered to double-check that medication order or question a procedure.
So the study, it involved 165 nurses, and it found something, well, pretty fascinating.
It really did. So attending that formal safety education, it definitely correlated positively with how nurses perceived the safety culture. They felt the culture was better if they'd had the training.
Okay, that makes sense.
But here's the kicker, that education, surprisingly, it didn't directly boost their actual patient safety competency. Not on its own.
Wait, really? No direct link?
Nope. And it didn't directly improve their personal safety control either.
Huh. That's counterintuitive, isn't it? You'd think more training equals better skills, right? So if it's not direct, what's actually going on? How does education help them?
Well, this is where it gets really insightful. The study uncovered this indirect path.
Okay.
It found that the safety education works primarily because it first strengthens the nurse's perception of that safety culture.
Ah, so the training makes them believe more in the hospital's commitment to safety.
Exactly. It sort of primes them to see safety as a collective effort, a genuine priority. And then that improved perception of the culture positively influences their own safety control.
So feeling the hospital values safety gives them more confidence to act safely?
Precisely. It empowers them. And that boost in their personal safety control is what ultimately leads to higher patient safety competency.
Wow, so just attending a lecture isn't the magic bullet.
It seems not. It's more about how that education experience changes their beliefs about the workplace, about their own role, their own power to ensure safety.
So thinking about applying this, what does this mean for you, for hospitals, for nurse training? It sounds like just scheduling more workshops isn't enough.
Definitely not. It really suggests we need to look hard at the content and the methods. Maybe less one-way lecturing.
Yeah, perhaps more interactive stuff, like simulations, maybe complex case studies that make nurses think about the system, not just isolated tasks.
That could be much more effective. And connecting this to the bigger picture, it just hammers home how critical fostering a positive patient safety culture is.
Right, that underlying environment.
Yeah. When nurses feel safety is genuinely number one, and crucially, that there's a non-punitive environment for reporting errors.
Meaning they won't get blamed for honest mistakes.
Exactly. That the focus is on learning, on fixing the system. When that exists, it significantly boosts their individual control and their overall competence.
It's not a quick fix, though, is it? Building that kind of culture takes time.
Oh, absolutely. Safety awareness, those habits, they build up gradually through lots of different experiences, consistent messaging, seeing leadership walk the walk.
And maybe training needs to be different depending on experience level.
That's another good point the study touches on. Maybe for newer nurses, you really emphasize the culture piece, make them feel safe. For more experienced nurses, perhaps you focus more on complex, real-world cases, systems thinking.
Makes sense. So this deep dive really shows us, doesn't it? Ensuring patient safety is way beyond just, ticking off training boxes.
It really is. It's fundamentally about cultivating that deep-seated culture where safety is just embedded.
Yeah.
And empowering every single nurse with the confidence they need to act on it.
Absolutely. So here's something for you to think about. If we really grasp this connection, this interplay between culture and individual empowerment, How could that transform safety outcomes?
Not just in healthcare, right? But
Yeah.
think about any high-stakes field aviation, energy, finance, anywhere that precision and vigilance are just non-negotiable. How much difference could that cultural understanding make?